After reading Gangler's article about healthcare inequality, I believe the families who have the most success in getting the best healthcare had more advantages than other people did. Some of the advantages mentioned in the reading were the ability to take off work, more medical knowledge, and obviously money. And this kind of showed me how uneven the healthcare system can be because those who knew how to navigate it better got the best results. The fundamental causes of inequality seem to come from more social based issues like education, income, and access to the proper information. I think lots of people struggle with the healthcare system because they don't know the type of questions to ask to get the best resources possible. Some evidence from the reading was how certain families had cultural health capital, research skills, and strong social networks, which helped them gain access to the best hospitals and treatments. The reading also noted how lower working class families were often filtered through the lower end hospitals or treatments. Gingler points out that the fundamental causes of inequality are education, social networks, and wealth. He also talked about how families with more resources could care captain, while others had to care and trust. I've personally seen how confusing it can be to navigate the healthcare system, as I've had older grandparents struggle with how to understand insurance, referrals, or even what the doctors were saying to them. To me, it makes it clear that those with more knowledge or medical awareness often get the best results. Next, I'll talk about the solutions in COVID 19. From the reading, Vincent's solutions seem to focus more on making healthcare more data driven and more family centered. The idea of a learning healthcare system is an approach to make sure the old routines aren't carried on. I think healthcare should definitely become easier to navigate and more affordable, as it's pretty overwhelming for most people. During COVID 19, especially, I feel like the system got stressed in a way that showed both its strengths and weaknesses, as some things like telehealth adapted quickly, but other parts struggled, especially with staffing and access. Vincent talked about how real utopias are practical alternatives to current systems. He also talked about how the learning healthcare system can gather data that will be used to improve it over time. Vincent also pointed out that COVID 19 exposed weaknesses in the healthcare system, which called for a social science of solutions. Some of the examples he mentioned were networks improving their admission rate for chronic illnesses and using data to maintain care throughout the pandemic. Since I was pretty young during the start of COVID, I don't really remember much, but I do remember seeing news stations talking about how quickly telehealth adapted and how virtual communication with doctors was surging. At the same time, I was told that most of the hospitals were overwhelmed, which showed me how a sudden crisis can shake an entire system. I had a cousin who was working as a nurse and was working incredibly long shifts, which showed how unprepared we were for a situation like this.